Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Suicide, Part 3. Parasuicide. The parasuicide would be all these actions of voluntary form and with intentionality of hurting oneself, in which the patient gets to injure himself without consummating the suicidal act, but rather it is an act of self-harm, either to punish oneself, to punish others, or to draw attention to oneself, and desperately ask for help. These actions are usually very measured by the patient, as they have no intention of taking their own life. They are actions in which there may be a lot of blood, but they know how to do it without risking their life. Blood scares those around the patient, and even more so if they see it gushing out in a scandalous way. Parasuicide has a very high risk of being a suicide simulation and entails all that this entails, such as death. Main risk factors for suicide: major depression, bipolar manic depressive disorder, schizophrenia, personality disorders, organic mental syndromes, disabling pain, recent disability, abuse of psychoactive substances, adolescents and the elderly, the most dangerous group, single, widowed, separated and divorced, loss of a loved one, loneliness, social isolation, imprisonment, abandonment, puberty, atheists, unemployed, more in urban than in rural areas, loss of social status, recent marginalization, very serious social, family, legal, or employment problems due to incurable or chronic physical illness that affecting quality of life, due to an argument. In men, the incidence increases with age, peaking at around 75 years of age. In women, the age of highest incidence is between 55 and 65 years of age. Family history of suicide. Behavior towards the suicidal person. We must approach the suicidal patient openly, never hide or try to approach him or her. Try not to let him or her see us, as this could frighten him or her and accelerate his or her suicidal act. We must approach him openly, without hiding anything, without him noticing our double intention, which is to prevent him from committing suicide. We should not trust him if he knows us, because probably when he sees us appear, he will not recognize us and he will only see all his fears reflected in our face. He will only see one person approaching him to prevent his suicidal act, and he does not want anyone to prevent his intentions. We must take everything the patient tells us very seriously, and above all believe it. We should not avoid talking about it, because talking openly about it is a relief for the patient. We must listen to him or her with attention and a lot of interest. making it easier for him or her to let off steam, allowing him to express his feelings, crying, anger, disgust, etc. Always ask for permission to involve other family members, friends, etc. for support. We should try to give him or her other options, never judge him. Ask open questions that allow us to know what he or she thinks. Try to extend the conversation by avoiding questions that are answered in monosyllables, yes or no, etc. We must not allow the suicidal person to continue to widen his tunnel vision that suicide is the only solution to his problems. We must help him to discover and find other alternatives. Never leave him alone. Be polite, sympathetic, and above all, do not show nervousness. We will move towards him openly. When he sees us moving forward and tell us to stop, we will stop. This is where the negotiation begins. When he calms down, we move forward again. If he gets nervous and tells us to move back, we move back one step. We move 2 steps towards him and move back only 1 step. If he continues to insist that we leave and he starts to threaten that he is going to throw himself into the void, we crouch down and show our face. We crouch down and show ourselves submissive, crouching down and always talking to him. We should never be too long without talking to him. When he comes down, we stand up again and always talking to him, we move forward a little more. If he orders us to stop again, we stop. If he gets nervous, we bend down. Here, we try to not move backwards. When he calms down, we get up again and move forward talking to him, telling him that we understand him, that we take him very seriously, that we understand him. All this allowing him to unburden himself. We must never judge him. When we are close to him at our fingertips, we try a more personal dialogue, where we must be very empathetic. Now we try to touch him, for example, by putting our hand on his shoulder. We will talk to him, trying to bring our hand closer to him, without the intention of grabbing him, but simply with the intention of touching him. We continue talking to him, and by bringing our hands closer, once we manage to touch him, he will stop trying to commit suicide. It is normal that once there is physical contact, they will stop trying to commit suicide. We will speak to him in a warm tone, looking him in the eyes in a loving way. We will never reproach him for his suicidal attitude. We will tell him that we understand him. We understand him and that we are here to do everything he tells us, and above all, to help him, giving him alternatives to suicide, explaining to him that although it may seem unbelievable, there is surely a solution. When we see him calmer and more confident, we will try to give him a hug. Here we have 2 ways. If we are sure that he is not going to commit suicide and that he is convinced that there are other solutions, we invite him to leave the place, assuring him that we will be with him at all times to help and support him. If we are not sure because he still insists on carrying out his action, we should trick him, for example, by telling him to give us a hug to say goodbye to him. Then, when we hug him, we hold him tightly so that they come quickly to our aid, and together we get him out of the place. without violence, without threats, and always respecting the suicidal person as a patient, as a sick person, and above all, as a human being. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Suicide Treatment Part 1. Remember, read the description of this video, you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.